For the best medical and paramedical lectures, subscribe to our channel and press the bell icon to stay connected with us.
Hello everyone, myself Ahmed, and today we will learn about tonsillitis. So let's begin. Tonsillitis. Inflammation or infection of the tonsil is medically termed as tonsillitis. Tonsils are protective lymph glands that are situated on both sides in the throat. The tonsil constitute an important part of the body's immune system and are vital defense organs. They protect the body from bacteria and viruses by fighting these as soon as they enter the body via oral or nasal cavity. This is tonsillitis as shown. White patches or nodules and uvula is inflamed and tonsils are swollen. Anatomy. In the normal state, the tonsils are pink in color, similar to the surrounding tissues, and are about the same of size. The tonsils along with adenoids are said to form the first line of defense against infective organisms. Pathology. When the tonsils get inflamed, they become red, swollen, and may develop pus pockets that start exuding a discharge. In case with recurrent infection, the tonsils may become so swollen over a period of time so as to almost touch each other. Tonsillitis is a very common amongst children. No particular gender predilection is seen in case of tonsillitis. Normal tonsils versus inflamed tonsils. The uvula is inflamed and the tonsils are enlarged. Causes. Bacterial and viral infection can cause tonsillitis through droplet infection. A common cause is Streptococcus bacteria. Other common causes include adenovirus, influenza virus, Epstein-Barr virus, para-influenza viruses, enterovirus, herpes simplex virus. Bacterial versus viral tonsillitis. In viral tonsillitis, only red swollen tonsils and throat redness is seen. In bacterial, the uvula is swollen, there is whitish spores, tonsils are swollen and throat redness, and the tongue becomes grey fury. Triggering factors. Foods with artificial colors and preservatives, peanuts, cold foods, cold drinks, ice creams, changes of weather, extremely cold climate, damp weather, exposure to a lot of population, soft fruits, lemon, pineapple, grapes, oranges. Signs. Red and swollen tonsils, white spots, specks or patches on the tonsil, and large lymph nodes in the neck region, bad and foul breath, cough, running nose. Symptoms. Soreness of throat, difficulty in swallowing, that is dysphagia, or painful swallowing, that is odynophagia of food and drink, pain and discomfort while swallowing saliva, change of voice or hoarseness of voice, pain in ears, earache, due to common nerve supply of back of throat and ears, headache, malaise and tiredness, difficulty in taking feed in babies. This may be the sole indicator in some cases of tonsillitis in infants. The babies are unable to take the feeds. Types of tonsillitis. Acute tonsillitis and chronic tonsillitis. In acute tonsillitis, there are 4 types: acute catarrhal or superficial, acute follicular, acute parenchymatous, acute membranous. Chronic tonsillitis, chronic follicular, chronic parenchymatous, chronic fibroid. We will see some of the important ones. Catarrhal tonsillitis. Here, tonsillitis is a part of generalized pharyngitis and it is mostly seen in viral infection. Membranous tonsillitis. Sometimes exudation from crypts may coalesce to form a membrane over surface of the tonsil, giving rise to clinical picture of membranous tonsillitis. Here we should know the differential diagnosis of the membrane over tonsil. Follicular tonsillitis. It may be acute or chronic. In acute condition, the infection spreads into crypts filled with purulent material. In chronic condition, the tonsillar crypts are full of infected tissue material which shows as yellowish spots. Parenchymatous tonsillitis. It may be acute or chronic. In acute condition, the tonsils are uniformly enlarged and red. In chronic condition, there is hyperplasia of lymphoid tissue and tonsils and tonsils are very much enlarged. Diagnosis: examination of throat in tonsillitis. Redness and swelling of the tonsil, yellowish bits, pus pockets on the tonsils in case of chronic tonsillitis, discharge from the tonsil, enlargement of upper deep cervical lymph node. We can feel it at the neck below the mandible. Diagnosis: throat swab. This is used to get a sample of the secretion from back of the throat. Monospot test. Blood test can detect certain antibodies, which can help to confirm that a person's symptoms are due to mononucleosis. Epstein-Barr virus antibody. If a monospot test is negative, antibodies in the blood against Epstein-Barr virus might help diagnose mononucleosis. Blood test. This primarily includes a complete blood count, which is done to confirm the presence of infection. Complication: peritonsillar abscess, quinsy, parapharyngeal abscess, cervical abscess, acute otitis media, subacute bacterial endocarditis, tonsillitis, tonsillitis. Cervical abscess is mainly due to suppression of jugular digastric lymph nodes. The systemic or general complications of acute tonsillitis are rare and almost confined to childhood. Septicemia. Untreated acute tonsillitis can result in septicemia with septic abscesses, septic arthritis, and meningitis. Treatment: allopathic treatment. Acetaminophen and ibuprofen are given for relieving the symptoms. Antibiotics are prescribed once bacterial infection is confirmed. Tonsillectomy. For those children who do not respond to antibiotics, in case of quinsy, also known as paratonsillar abscess, it is usually treated by draining the abscess and antibiotics. Sometimes removing the tonsil is needed to treat quinsy. Prevention: avoid close contact with others who are sick. Keep children away from kids who are known to have tonsillitis or a sore throat. Remind kids about the importance of proper hand washing, especially when around people who appear to be sick. Wash and disinfect surface and toys. Teaching kids to cover their mouths when coughing or sneezing, preferably using a tissue so that germs do not get on their hands, and show them how to use tissue to wipe their noses. Carry disposable wipes or hand sanitizer to clean hands. Thank you.
Do like, leave a comment, and share with your friends.